The first thing I'd like to do tonight is recognize the team for putting all of this together. I cannot tell you how dedicated and creative our team is. They're just absolutely fantastic. Every year it just gets better and better. And so thank you very much to everyone. Everybody on the team worked very hard to put this together, but Elizabeth is the coordinator, the queen of the family education night. So thank you very much, Elizabeth, for putting this together. Okay, so my name is Kim McBennett. I am the CF Center Director. I am here to welcome you and give you a little bit of an update on what's been going on since last year when we had one of these meetings. I take care of adults with CF, and I don't see any of my colleagues. I was going to introduce you to some of the other doctors, but we've had lots of changes in the CF Center, as you've probably noticed over the past year. I know that there's new faces, there's new processes, and that's all by, well, not all of it by design, but our new processes are by design. The people, the team members that you see in the room today have worked really hard on our quality improvement initiatives to try to improve the processes that you see every day in the CF Center. So I wanted to go around the room a little bit. We have a new nurse on the adult team. Margaret, can you stand up so everybody knows? This is Margaret, and she is working with us. She has many years of experience in Akron at their CF Center, and now she's here with us in Cleveland. We have a new pediatric nurse since last year. This is Katie Paymer. Can you say hello to everybody, Katie?
Today's her birthday.
And today is Katie's birthday, so happy birthday. Okay. And we have, I don't know if our office manager is new from our actual patient education day. When did you start?
Just the week before it.
Okay, so we have an office manager who is now kind of like the ringmaster of the entire circus, and she's doing a great job pulling everybody together. And let me see. And Dominique, I don't see Dominique. She's checking people in. Okay, so Dominique is our new dietitian that you've probably seen her face. We have a social work intern that's working with us now, McKenna. Can you say hi, McKenna? And so Elizabeth is helping to educate McKenna, and she's doing a great job as well. So updates. One thing I wanted to bring to your attention is that many of you know that we lost a beloved member of our team. Sue Koziel passed away suddenly in February, and we're all really reeling still from that loss. One of our patients' moms has started a fundraising effort to start some education at Rainbow for other caregivers about CF. And there's information out at the check-in table about that if you'd like to hear more about that fundraising effort. It's just a way to memorialize Sue and all that she did for our center. Secondly, the Patient and Family Advisory Council has a table here today. Nick is, what's your official title on the council now?
I'm the co-chair.
Co-chair, and he works with Karen Vosper, and this council has been very important to our center to help guide us and tell us the things that patients and families want and need from our center. And so thank you very much, Nick, for your contributions. I think Mary Jo, are you on that as well? And Mary Jo Joyce is here, and she's also on the Patient and Family Advisory Council. Nick, did you want to say anything that what the council's been up to lately?
Yes.
All right, come here. We're just doing this real informal today. There's no slides.
This is really taller than me. I don't appreciate that. There we go. All righty.
2 minutes.
All righty. No. So the Patient and Family Advisory Council, for those who do not know, is a group with individuals who work at the hospital, patients and families, and people actually with cystic fibrosis. Our basically objective is to improve the quality, the experience, and the safety for both patients in and outside the hospital. One of the things that we've been able to do is start some very cool initiatives. One of those new ones is rooftop yoga. So that opportunity has been really good. A lot of people have really enjoyed it, while continuing the work of some of our older initiatives, which was massage therapy. We have that biweekly. It's not something you normally think about our patients while admitted getting massages, but that's been something that's been really important to us, as well as we have what's called our Brighten Your Stay bags. So when you get admitted, you get a bag full of hospital essentials, good toilet paper. You guys have no idea how important that one is. Chapstick, lotion, lemon heads for the taste for the meds, as well as a $20 Visa gift card. The idea is to help offset whether it be parking, food, and all of this came way by what, as Dr. Moon was saying, the information we get from our patients. So we created a survey to really try to gather information from our patients and families to ultimately try to meet their needs and to grow the center as a unit. So ultimately, those are what we do. Is if you have any questions, like I said, come over and talk to me, come over and talk to Mary Jo, Patricia, where are you at? Right there, all members of the council. Like I said, the idea is really just to improve our center, both from the inside and out. And the way to do that is by getting information and having initiatives.
Thanks a lot, Nick. That was awesome. Thank you. So one of the other initiatives we have in our center right now is a quality improvement initiative. And the quality improvement team has a table at the back of the room. And if you want to stop by and hear about some of the quality improvement things that we've been working on, Lisa, our pharmacist, is in charge of the quality improvement initiative. She's kind of our quality improvement guru. And I think we also call her the queen of the quality improvement. And basically what we do is we look at, as a team and with patient and family involvement, any process that occurs in the CF Center. So everything from checking in at the front desk to having PFTs done to medical decisions that are made to medications that are started. We want to make sure that everybody is getting the best care that they can get. And so we as a team, with the help of patients and families, come up with ways to improve that care. So if anybody's interested in being a part of that and likes to go to meetings, but would like to be a part of some of the projects that we do, please let us know. We're always looking for family and patient members of the quality improvement. And there are some cards on the tables. Lisa, did you want to talk about what those cards are for?
Sure.
Hi, I'm Lisa. So we put these cards out at your tables, and really what we're doing is just trying to solicit feedback. So if you guys have anything to help us know what's the recipe for a better CF center, you can write it on here, and you can either turn it in here, and we'll come around to the tables and kind of collect them, or if you want to give it some more thought and keep it, and you want to let me know later. I put my information, my phone number, my email address is on all these cards. It's also in the little recipe books that we made back there. So if you stop and get some trail mix, and you can calculate the number of calories in each of the ingredients of the trail mix, and we have put some recipes together, recipes that the team members like, so you can get us to know us a little bit through the recipes. Stop by, get them. It's also got my contact information, so even if you don't want to go to the meetings, but you want to kind of participate a little more peripherally, that's fine too. Just, if you want to be maybe a point of contact, or maybe if we want to run something by you, it doesn't have to be a huge commitment. So whether you want to participate a lot or participate a little, we would love to have you. So
Great. Thank you so much, Lisa. And I know Linda participated, and Mary Jo participated in quality improvement projects with our center in the past, so they can tell you what you're getting into. And the last thing I wanted to bring up was our clinical research program. As you know, we are very active in clinical research at Rainbow. at our CF Center, we have anywhere between 18 and 23 open active trials at any one time. Not all of them are enrolling, but many of them are open. We depend on our patients to enroll in these trials in order to bring new therapies to market. And so we really appreciate all of our patients and the folks and the parents who bring them to the study visits and the people who are willing to participate in the research. We have a table over on this side of the room. You can see Cindy Schaefer. Give them a wave, Cindy. She is one of our research coordinators, and if you have any questions about research trials, how to become involved in research, please stop by and talk to Cindy. If you want to hear any more at your clinic visits, please ask, and your docs can either talk to you about it or they can go and grab some of the research staff. And that brings me to the next part, where well, before I get to the basic science research, I wanted to ask, in the past, I have just kind of done an open mic thing where I've asked patients and families if there's anything that they have questions, comments, or concerns about. You're here. I'm open to hearing any kind of ways that we can improve our center. Is there anybody who wanted to comment or bring up any questions or concerns that you have about the center right now? You're always welcome to reach out to me privately if you have any questions or suggestions. We love to hear that. And so next, I'd like to introduce our next speakers for today. One of the things that everybody always loves about our family education night is hearing from Dr. Mitch Drum about the research updates when it comes to the basic science research and how that applies to the medications that might be coming down the road for people with CF. And today he has one of his colleagues, Dr. Becky Dara, with him, and she is also a PhD in genetics. But Becky has two roles with our center, and one is that she studies cystic fibrosis in the lab, and the other is that she's a licensed genetic counselor, and she is going to join our team to do genetic counseling for our patients moving forward. You'll start seeing her in the clinic probably in January, and she will be there to assist with everything from new diagnosis to, when it comes time to have babies and build a family. We're really excited to have Becky joining the team. So without further ado, may I have Dr. Drum and come up first? Okay. All right. Well, thank you so much to everyone for coming tonight. I really appreciate it, and I hope that we meet your needs. And there's evaluation pages on the table if at the end of the program, if you don't mind writing some thoughts down. Thank you.
Thanks, Kim. So I thought what we do tonight is I'm going to go over sort of some updates on things, but leave some time so that we can talk about what you want to hear rather than what I want to tell you. So, but one of the messages I'd like you to leave with, and I think that Kim alluded to, is that our group, I think, is quite special in that we really do use a team mentality, not just on the clinical side, but between the clinical side and the bench research side. We're talking to each other all the time. I can come up with 1,000 questions of things I'd like to do, and then Kim says, no, only this one is important. And so she can help guide what's the clinically relevant parts of it. So just sort of an overview, we'll talk a little bit about the therapeutics that are coming along for CF right now. There's a lot of buzz about what's called the triple combination. So I want to walk you through that a little bit and try to help you understand what's involved in that, how they're working, and things like that to give you a better idea. Gene editing, actually going in and fixing the DNA, is something we think is now a realistic possibility, so we'll touch on that a little bit. And there's some other novel strategies that are cooking there too that we think we can put in to get some of the mutations that won't be addressed by the other methods. There are also some, the CF Foundation has embarked on some new initiatives on the research front too, and so I wanted to let you know there are things going on behind the curtains you may not be aware of. And then I'll transition over to Becky to tell you about the her role in genetic counseling, and I think that's one that most people don't appreciate, the nuances of the genetics of CF. We know there's over 2,000 different mutations in this one gene that can cause CF. And so now we're not thinking about it as you either have CF or don't have CF, but it is more of a continuum, and you can be anywhere along that line, and the genetics help us understand that continuum. So my little CF 101 for you, so this is our buddy CFTR. This is one of our 20,000 genes that sits on chromosome 7. It's a relatively big gene, but it has a bizarre, from human genetic standpoint, it has kind of a bizarre pattern that there's one common mutation, this thing we call F508del or delta F508. 70% of the CF chromosomes out there in the population carry that one mutation. All the rest of those 2,000 other mutations make up the other 30%. So it's skewed quite a bit. But what it means is that 50% of the CF patients out there on both chromosomes have the delta F508 mutation. About 40% have one delta F and something else. And then about 10% have something else, something else. So you can imagine then all the permutations of no two people being quite the same in terms of their CFTR genotype. And this is as sciencey as I'm going to get for the rest of the thing, but just I think in order to talk about how the therapies are working, you need to understand the different steps that are involved. So, we go on the chromosomal level, you've got the CFTR gene. It gets copied into RNA. That RNA gets modified, and then it makes the protein, this thing that looks like the pretty colored ribbon over there. That's the actual functional protein. But I love analogies, so this is my attempt for this year's analogy. So remember, you've got 2 copies of CFTR, and that is your cell's instruction manual to how to make this CFTR protein. So you got 2 copies of that. So as long as one of them's working, you're in good shape. Well, those manuals then are used by the Xerox here to make thousands and thousands of copies in each one of your cells that's making CFTR. Those copies then get sent to a different place in the cell, and then the editor takes their hand at it and starts ripping out parts that aren't needed for that cell's job. And what's left then is used by the cell to make the final CFTR protein. So this is a guy that's what we call a channel, meaning that it's kind of like a hole in the cell that allows things to come in and out of the cell. And we know CFTR lets salt go through, a chloride from salt, and also bicarbonate. So that's your Arm & Hammer baking powder, or baking soda, sorry, not powder. So that's really the way the process works. And when it's in the CF case, you can have all kinds of ways of not getting a functional CFTR at the end of this. So if the first step is not working, you don't get enough copies made, so you're not going to get anything at the end of the process, or get enough. Mutations may disrupt that message getting to where it's supposed to be in the cell. The editor may be drunk and just messing up things right and left, or the mutation may cause that channel to be misformed and not work quite correctly. Okay? So those are the different places. So you can imagine then, if you've got that many different ways to mess it up, there may not be a single type of a treatment that will address all the different mutations. So where we are right now, we don't have anything that will fix the DNA. We don't have anything that will fix the copier. We don't have anything that will fix the transport. We don't have anything that's going to fix the editing. What we have right now are these modulators, the Vertex drugs, that will help the mutant protein function. And they work in 2 different ways, and I'll tell you a little bit more about those in a way. So we've got a lot of holes to fill. Now, Fortunately, most patients with CF have that last category, have these proteins that aren't formed quite correctly. So the Vertex drugs actually should address the mutations in most individuals. I throw up a couple of mutations so you can see how ridiculous the nomenclature is, and that why you need a genetic counselor to help you understand what these things mean. And some of those may be familiar to you. But now my next analogy is walking through sort of how CFTR is made. So when the cell makes a protein, it's basically a long stringy molecule, but that molecule has to fold into a certain conformation to be functional. So, and in here, the ribbon's getting folded up and becomes this channel. And this channel or valve here really does work sort of the way that CFTR does. That blue handle is sort of reflecting the fact that there are signals that tell it when to open up, when to close, and how it can work and stuff. So we have mutations that can affect that part of it, or we have mutations that can affect whether it can open at all or even get to the right place that it's supposed to be. And the modulators that have come out so far have their effect in the following way. So that if that folding process doesn't work right, and that's one of the biggest issues with the Delta F508, that protein's just not forming the way it is. So the first set of drugs that were screened for that particular process, one that came out was called lumacaftor. Right? Well, lumacaftor helped the folding of the Delta F508 protein, and it worked really well in a dish. But when it got to patients, it just didn't have enough of an impact. Well, at the same time that the screening was going on, Vertex had found another drug that was called ivacaftor. Right, so ivacaftor works on the blue handle, so it's one that lets the protein work better. And it worked, as many of you know, that drug works very, very well, but it works on a subset of the patients. So what was then tested was, well, we have one that doesn't work quite well enough for the folding, but we have one that works on the activity. What if we put them together? And that actually turned out to work fairly well, and that was a combination of drugs that was called Orkambi. Well, the next phase of that was to say, well, Orkambi, that's great, but there's some issues with lumacaftor. There are a few patients that don't tolerate that real well. So another one was developed called tezacaftor. And tezacaftor looks like it works exactly at the same place as lumacaftor. So it was replaced, and so now the combination of ivacaftor, tezacaftor, that's now called Symdeko. Okay. Well, that's great, but then that combination seems like it works on folks who have 2 copies of the Delta F508 mutation, but not if you only have 1 copy of it. So they said, well, if 1 works well, what about 2? And so the latest studies that are going on use another one called elexacaftor, and elexacaftor works at a different place in the protein, so its effects are actually additive. So if you take the tezacaftor and elexacaftor and ivacaftor all together, so the tezacaftor and electrocaftor, those work on 2 different parts of the protein that together make it fold even better. And then you throw ivacaftor on top and you get it to activate more. And that triple combination is what is going to be coming out next year. At least that's the plan. And the folks over here at the Vertex table can keep me honest and tell me when I'm lying about things. But the studies that I understand are looking very promising. And so if that works as well as it appears to, then we have a drug combination that should be effective for about 90% of the CF population. So that's really quite remarkable. So, but there's a lot of other mutations out there that they're rare, but they're not things that we're going to overlook. We have this, no patient left behind, so we want to make sure we've got something for everybody. So, so what's going on to do that? Well, the CF Foundation has invested quite heavily in these new technologies called gene editing as a group. One of them that you've probably heard about is CRISPR-Cas9. So this is a strategy where if you can direct a break in the DNA, you can trick the cell when it repairs that break in the DNA and make it be whatever you want. So if we can break the DNA where there's a CF mutation, we can trick the cell into fixing it and repairing the mutation that was there and making what was a CF mutation be a normal DNA sequence. And then there have been a lot of nuances to that people have, it's like duct tape, that people have figured out 1,000 ways to use it. So the CRISPR-Cas system has been modified by a number of different people, and some clever ideas have come out of that. So I feel really, I'm excited by all the things that are coming along that way. The mutations that don't let enough copies being made, those could be also treated with, if the gene editing works. The process of not getting enough sent to the right part of the cell, there are strategies going on to try to get these things to read through these what are called stop mutations or the X mutations. We'll see what comes of that. Again, a lot of clever people putting new ideas to test. But anyway, the foundation has put out what we call requests for applications. They've got money set aside that they're putting into these endeavors. So the read-throughs and the gene editing are the two right now. And a third that is out also is you can come up with these great strategies, but you need to have a way to get the stuff into the right cells. So if I can find how to do something in a dish, that's wonderful, but how do I then get that to work in an airway or a pancreas or the intestines in a person's body? So there's another request for applications for that part of the strategies as well. And I'm telling you this just so you know that, I don't think these are things you hear about very often, but the foundation is very, very much committed to the basic research to find out new ways to do things. Then I put this slide just to remind me of a number of the different things that we're doing here locally. So we are one of the gene editing groups that is being funded by the CF Foundation. We recently also got one of our colleagues in genetics who's an expert in understanding how the RNA is processed to encode the protein, and she's applying her knowledge to these what are called splice site mutations, and that's one we haven't had any really progress on, so I'm excited to have her involved. We are also working on things that don't involve CFTR. So throughout the 20,000 genes across your genome, there's several of those that we know can influence the severity of disease. So, and in fact, Dr. Dara is working on one of these as well. So looking for things that would work no matter what your CFTR genotype is. We do a lot of work with mouse models too, and the reason for this is, like I said, we can do stuff in a dish all day long, every day, but we need to know whether or not what we're seeing would be relevant in a living organism. And the mouse is a very useful tool for us in that regard because we can manipulate the chromosomes. We've engineered mice to have CF mutations, so we can try fixing things there before we try to move into the clinic with things. And for things like the modulators and the gene editing, we need to have the human gene involved. So we've made mice now where we've removed the mouse CFTR gene and we put the human CFTR gene in its place so we can test our therapies on those. And also creating some that are a little more sci-fi in them, that we've made animals in which we put in a version of a firefly gene. So we make it so it has a CF mutation in front of it. And if the mutation's there, the light doesn't go on, but if we fix it, the cells light up and it's a lot easier way to detect whether or not you've repaired something. So we've got all those tools that we've put together, and so that whether it's us or another group who thinks they have a therapeutic strategy, they can send it to us. We can try it out in the animals that we've made. And then the other thing I wanted to mention, that the foundation has been very good at listening to what families' concerns are, and one of the resounding messages was that infection is something that all the families worry about. And so they also have a request for applications out now to try to understand CF infections, try to find ways to fight them. So new antibiotics or whatever it may be, we need to understand and fix those. And then also there is an emerging emphasis on transplant and the things that go with that, because as people are getting older, this comes up more and more, and so we have to be in a position to deal with that. I don't think I can answer any questions on the transplant part of things, but just to let you know, though, that there is research now, that money set aside for research on the transplant front. All right, so this is going to be my segue for Becky to come up, but I put this mess of a slide up just to impress upon you. This is just looking at a handful of the different mutations. Like I said, there's 2,000 different ones, and there's no way anybody can know everything about all of them. But in this age where modulator therapies or gene editing, if it comes to be realistic, what mutation you have is more important than ever in terms of these personalized kinds of therapy. So, before, if we were treating the symptoms, it really didn't matter so much what CFTR mutation you had. You could just, you have CF or you don't have CF. Now, when these different drugs and approaches will only work on specific mutations, we really need to understand those better. So I'm going to hand over the mic to Becky, and then I think we'll have plenty of time for questions if anyone does.
All right, thank you. It's nice to see everybody. I'm looking forward to working with everyone in the clinic starting in January. So I am a genetic counselor. The field of genetic counseling was born out of recognition that this stuff is confusing. If we look back at that slide, all of that means a little something to geneticists, but probably not a whole lot to everybody else. The idea was that we need somebody, a dedicated healthcare professional, whose sole job it is to help explain this in an hour or more, even sometimes with families, what exactly is going on, what does it mean, and what kinds of tests can we do, how can we translate that information into something clinically meaningful that doesn't just have repercussions for the person with CF, but it also has repercussions for the rest of the family members. And I think that's where genetic counseling differs a little bit from medicine and nursing. It was an idea that we need a separate group of professionals that can deal with all of the complex information that comes with that kind of knowledge. So genetic counseling can help interpret those complicated genetic results, as Mitch mentioned, just understanding what exactly is going wrong with the gene. Where does that put you in terms of which of the new modulator drugs, excuse me, might be predicted to work the best for your situation, helping to navigate all of that type of thing. Certainly as more advanced kinds of things like the gene editing come down the pike, then the genetic counselor could be useful in facilitating those. But for right now, it's interpreting a lot of the complicated genetic results and explaining these to both the families and the caregivers. Working with families on testing family members to see if they're carriers, if they want to know about their chances for having a child with CF. We work with talking to the rest of the family. Most people with CF do not have a family history of CF, but there are many other people in the family that are certainly have a chance to be a carrier. Helping families and people with CF with reproductive decisions and options. We do a lot of that. There are many ways that somebody with cystic fibrosis can have their own biologic family. We help facilitate those kinds of decisions and talk about options and talk about all of that with both people with CF and their family members. And then helping people, patients themselves, and also the caregivers with challenging or unusual diagnoses. So when cystic fibrosis was diagnosed solely based on a sweat test, we had a real clear answer of you either had CF or you didn't. But now in the era of newborn screening, which you're probably aware of, we get a lot of these sort of intermediate cases of, it might be CF. We're going to follow this child in the clinic and sort of wait and see, which can be a really frustrating answer for families. So part of genetic counseling is explaining exactly why that is. Why can't you tell me yes or no whether I have CF, whether this baby has CF, working with adults who are newly diagnosed, which does happen, and they usually have an unusual presentation. It's not typical for somebody to go most of their life and not know they have cystic fibrosis, but once in a while, due to maybe a more mild mutation, we might see those families. So that's a little bit about what genetic counseling can offer, and I'm happy to answer any questions that you might have about my new role in the clinic. All right, thanks.
Any questions?
There's one over here.
Yeah.
With the genetic counseling, from that aspect, are there?
Yeah.
That's fine. Can you hear me?
Yeah.
All right. So with the genetic counseling, my question is there information that says because of various mutation, this person has X or Y mutation, it affects what bug or the thing they can get? And is there a treatment implication that says I have X mutation, maybe not one of the standard deltas, this course of treatment or action might be most effective for me?
Right. That's a great question, and that's certainly where we're headed. So this idea of personalized medicine, whether we're looking at variation within CFTR itself or variation in the rest of the genome, that's the goal, is that I can look at your personal sequence and say, here's the best course of treatment for you. And that's happening in the cancer field really readily, and we're working on it for cystic fibrosis, I will say. Definitely for the modulator drugs, what mutation you have predicts what drug we think would be the best course for you, but we're working on it outside of that as well. So stay tuned.
So to add on to that, I don't know if we have your cells, Nick, but a number of patients we've gotten nasal cells from, and it's not feasible for us to figure out all 2,000 different mutations and who will respond to what. So we're taking a different approach and just say, I'm going to take your cells, put them in a dish, and add the modulators to them and see what you do or don't respond to. And that way we can get an idea of which drugs are correct for which persons. There are some, we know for some of the mutations who will respond to what, but the really rare ones, we just don't know, and that's the only way that we think of to figure it out.
That's a concept called theratyping you may have heard about, so that's what that refers to. Mm-hmm. Other questions?
With the medications, if I understood you correctly, ivacaftor.
I was asking if ivacaftor activates things more, and Alexa, the new one, makes things fold better. What's lumacaftor do? So
lumacaftor and alexacaftor basically do the same thing, but at two different places. And so, when I show in the bow, you got the left hand and the right hand. That's one's the left hand, one's the right hand, and so together. Whereas the lumacaftor and tezacaftor, those basically are the same. They're both left-handers. They're hitting the same place. Right? So by adding the alexacaftor, you get additional folding benefit.
Is there anything about that would make lumacaftor better and more effective on the digestive system?
So I don't know that we have, most of the focus is on the lungs. So I don't know whether or not there's any evidence that one works better in a different tissue than the other. I don't think that's been looked at. It's usually the sweat chlorides are looked at and the lung function. But I just don't know that there's any evidence. Yeah, that's a good question.
You're onto something really important there, though, that what works for the lungs may not work for other symptoms, and I think that's only now starting to be really fully appreciated with the correctors. That's great.
All right. Then, thank you very much.
Blackerwelder. I got to know Tracy when I worked at the CF Center in Cincinnati, Ohio, prior to coming here to Cleveland. And I met Tracy there and her children. And she's going to give a lot of background about her family and her story. So I won't tell you too much, except I'll say that you'll realize she's an amazing woman. And to know her in person, she's even more amazing than what you'll hear from her tonight. So we're very happy to have you here, Tracy.
Have you ever been to a CF meeting and had a rooster in front of you? This is your first? Well, thank you so much for having me. It's been so fun to get to know and meet new friends. I always love that. It always makes me a better person when I meet some fantastic people. Well, the summer that I was 8 years old, I killed my grandpa's prized rooster. It was an accident, but I did it nonetheless. So I grew up in the city, and every summer my mom and dad would pack up all my stuff and take me to eastern Kentucky to live on my grandparents' farm for the summer. They lived on 300 acres in a tiny, tiny little town called Three Links. And I was not the typical farm girl. I did not like to get dirty. I didn't like to be hot. And I wore dresses every single day. But I was the typical farm girl, and that I loved the farm animals there. And because of that, and because of my age, my grandparents gave me the task of feeding the ducks and the chickens every day and taking care of them. Now, there were not a lot of children around, although my cousins lived not too far away. And I found out later that they used to secretly call me Princess Foo-Foo because I was not that, farm girl. But because there weren't a lot of kids around, I really had to use my imagination. And I would come up with all kinds of games and skits and things like that. And that was pretty much my life for the summer. It was pretty fun for a kid. There was one particular day when my grandparents had to go down to the fields and bring in the hay. And that was that hot, dirty job, and I did not want to go. So because I was a good girl, my grandparents let me stay at the farm and be there with my own devices. And I played, and after a while, I kind of got bored. And so the way that their farm was set up was at the top of the hill, there was their farmhouse. And down the hill was the barn and the granary and the chicken coop. And so because I was bored, I decided I would get some chicken feed and I would throw it on the road and have the chickens kind of all over the road. And I went up to the top of the hill and I ran as fast as I could down the hill and just tore through those chickens. And they're like, bok, 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 and they're going crazy and feathers are flying all over the place. And it was pretty fun. And I remembered a few days earlier, I'd watched Hogan's Heroes. I don't know if anybody remembers that, but there was some bombs and things going off, and I thought, that's what I need. I need ammunition. That's gonna make it even more fun. Really get these hens going. And so I went down to the granary and I got some corn cobs and I pulled my dress up to make a basket and I filled it up with corn cobs, put some more scratch on the road and ran up the hill. And as soon as the chickens were out and ready, on the path, I tore down the hill again. And this time I would throw corn cobs in the air. Bombs away, bombs away. When I got to the very bottom, I had one corn cob left. And I threw it extra hard, just at the same time as my grandpa's prize rooster, Charlie, came out of the hen house. He was probably wondering, what the heck? What's going on with all these what's going on with my ladies? My corn cob, he walked right in front of it and it nailed him right in the head and plop. He is down on the ground. And I ran over and I'm like, Charlie, Charlie, wake up, Charlie. And he was definitely not waking up. And I remember my grandpa and he was stern and strict and a big man and he loved Charlie. And I got scared and I started to cry. And my grandma had made her way up to check on me. And she saw me sobbing. And she ran over and Tracy, Tracy, are you okay? And I said, I killed Grandpa's rooster, Charlie. And she's like, you killed Charlie? And I told her what happened. And she said, it was an accident. It's okay. And she wrapped her arms around me. And I said, but Grandpa's going to be so mad. And she paused. And she said, no, he's not, because I'm not going to tell him, and you're not going to tell him, and we're going to take this shovel, and we're going to go bury the rooster down by the post box, and because your grandpa goes the other way, and no one will know. And that's what we did. And a few days later, we're sitting at the table, and my grandpa leans back in his chair, and he says, you know what? I haven't seen Charlie for a while. Has anybody seen Charlie? And immediately my heart starts beating super fast, and my throat's like closing in, and my face is red. And it felt like I had like a sign, like rooster killer, rooster killer, rooster killer. And I was about like opening my mouth about to spill it. And my grandma stepped in, and she said, oh, Sam, I saw a weasel down by the chicken coop. And my grandpa cussed up a storm, and my grandma caught my eye, and I knew at that moment that she had my back. And I knew that I wasn't perfect, and heck, my grandma wasn't perfect, because she was teaching me how to tell the biggest freaking lie ever. But it felt so good to know that I had someone that had my back. And it's the same for us when we're dealing with CF and illnesses and challenges, and we have fear and worry and discouragement. It's hard, and we need to find people who have our back. And so tonight I kind of want to discuss with you not only how we need people to help us, but also how we can find happiness and joy and peace despite the challenges that we might have. So I wanted to kind of tell you where I'm coming from a little bit. I met Terry. I volunteered at Children's for years and years. We worked in the quality improvement area in family-centered care, like perfecting families. And so I did that for a while, and then I got a job at Children's where I worked there for 8 years and helping in quality improvement and helping the staff there be able to learn how to work with parents, how we can be a team, right? And then after a while, about 5 years ago, guess what? We bought a farm, and now I'm a farmer, which is like really weird, but that's what I'm doing now. But I also, one of my favorite job of all is that I'm a mom. And I'm a mom of 10 crazy, crazy kids. And so that's usually when everyone's like, what'd she say? Did she say she's got 10 kids? Like, are there like, how many moms? How many dads? Like, no. There's just one mom and one dad, and we got together and we had 10 kids. So yeah, I know, right? It's fun. It's fun though. So what I wanted to do was to give you a little glimpse into what our life is like, and hoping that maybe you can take what you will. And I'm going to give you some suggestions and some things that have worked well for our family. And you know what? It seems like sometimes we try things and it works well for a while, and then maybe like even a week or 2 weeks later, it doesn't work anymore. And we have to switch it up and try something new. And so just take what you can. And then maybe also when you hear a little bit more about my story, you can give me some advice and maybe some ideas that you have for me to help with my family, because we're all trying to be our best, right? That's what we're here for. So this is my crazy crew. We have 7 boys and 3 girls. So this is my oldest son, Taylor. And Taylor is 30 years old, almost 31, which is kind of super hard for me to say, because how do I have a child that old, right? He has cystic fibrosis. He was diagnosed at 2 months old. We kind of fell into this 2-week gap. He was born, and I'm from Cincinnati. So he was born at Christ Hospital there, and there was a 2-week period where there was a medical student who was doing some testing on meconium and testing just for 2 weeks on cystic fibrosis, and we fell in that 2-week gap, which is a blessing, because then we were able to find out about CF, which I had never heard. I was a super young mom. I was 19 years old, never heard of CF before, but I learned pretty quickly. Taylor is a pretty healthy kid, only in the hospital maybe 2 times as a kid. He was a state wrestler, varsity soccer player. He graduated from high school, went to Brigham Young University, studied business. After his freshman year, he decided he wanted to go on a service mission. So he went on a mission to Oakland, California, which was pretty hard to send your kid that far away when they're kind of young and they're dealing with health issues. It was hard. He wanted to be there for 2 years. He got ill and had to come home after 9 months, then went back to Brigham Young University, met his sweet wife, Megan. They got married. He was studying business. His junior year, he decided he wanted to be a dentist. And we were like, how is that going to work with a CF? How is that, but that was what he wanted to do. So one thing that we do is like, if you have a dream in our family, we're going to get behind you 100%. Even though maybe, like for me, it didn't really make sense. But for him, it did. And so it was important that we got behind him and backed him up. But he was studying business. So he had to switch gears and then study science and biology. So his junior year, he was taking 20 credits. And then his senior year, that one semester, he was taking 20 credits. And the last semester, he's taking, again, 20 credits. The first 2, he did really well. He worked really hard. But that third semester, when he was about to graduate, he got sick, probably worn out, and he had to go into the hospital on IVs. He missed a ton of labs. They wouldn't let him go home on IVs. And when he got out, the next week was finals, and he didn't do very well. And getting into dental school is pretty competitive, and he didn't get in. And he was super angry, and he was like just mad and just hating life. And then he straightened himself out a little bit. It's okay to feel sorry for yourself, right? Like that's okay sometimes. But we need to figure out how to pull ourselves out of that feeling. And so we did a ton of service, which is what our family is all about. That's what we do to pull ourselves out of when we're kind of digging a hole for ourselves. And Taylor he graduated, then got a master's degree in business, and came back to Cincinnati and is now working in my husband's company. But the sweet and exciting thing is that Taylor and Megan have 3 of the most amazing, cutest kids in the world. It was hard to get these kids here. They used IVF. It was a challenge. But they worked through it. And now, look at these kids. They're pretty darn cute if I do say so myself. They're pretty sweet. And that's Taylor. So sometimes we look at someone's life and we think it was all peachy keen and so easy, right? But it wasn't easy. There are challenges along the way. But the important thing is to try to figure out how to find happiness and joy despite those challenges that we have. I have a daughter, Beth. And then my third child is Brent. This is Brent. He was sick pretty much. He was a sick kid. We figured out he was probably in the hospital between 60 and 80 times, like in and out all the time. He hasn't been in the hospital for the past 3 years. And I don't know why. I know he's stubborn and sometimes he should be in the hospital, but he doesn't go. But somehow he pulls through it. Brent really tried hard in school to compete in athletics, but he couldn't keep up, and he would always be in last place. But he taught a lot of people about perseverance and still finding joy, even though, last place can be a bummer, but he still figured it out. He decided after he graduated from high school that he wanted to go to BYU, Brigham Young University in Hawaii. And I was like, well, what the freak? No, you can't go to Hawaii. That's like 15 hours on a plane. You have to go across the ocean. What if something happens? But that was his dream. That's what he wanted to do. And so we researched and we found some friends out there and we sent him to Hawaii. And he was there about almost a year, and he got sick. And he figured out on his own that Hawaii wasn't the place for him. He came home, got well, went out to Utah, finished up school there, and is now a farm manager on our farm, which is pretty sweet. And then I had 3 kids in there, 3 boys without CF. And then there was like a love explosion that hit the world. And that was when my daughter Tess was born. I have some stories to tell you about her, and I'll tell you a little bit later. But Tess, she passed away at 7.5 due to complications with CF. She is a great teacher, an amazing teacher. There really was an explosion of love that went man, all over the place. And so I'll tell you a little bit more about her in a little bit. Then I had another boy, Trevor, and then this is Bridger. Bridger's almost 16. He has CF. He's a rascal. He's always been a rascal. Terry kind of reminded me when he was 4, he was on an insulin pump and he did not like to wear it. And at the preschool, he took off his pump and put it in their little cubby. And later that day, like we came home and we couldn't find it. I didn't know what was going on. Well, the cleaning crew in the school heard the beeping sound and they called the police. And the bomb squad came and the fire trucks came, and we just live in a tiny town, and it was like the talk of the town. And Bridger has always been a rascal. And you know what? Sometimes I think having a little feisty is kind of good, even though it's not good, but it's good sometimes. Bridger is a varsity basketball player and soccer player since his freshman year in high school. He is all about being competitive, but not about sharing CF. He likes to keep it on the down low. He doesn't like people to know, although everybody does. But he feels like he's treated differently. Coaches and teachers, he doesn't like to be babied. He doesn't want to be taken out of the game because his face is red. And he thinks because if someone knows he has CF, that they treat him differently. And so we're working on that. So if anybody has some ideas of how I can get him to be a little bit more open, let me know. And then 6 years later, another explosion happened. And that's when my daughter Lily was born, and she has CF also. So I'm coming to you with a little bit of knowledge about CF, and I hope you'll be able to take maybe a little bit of what I'm saying and be able to use that. I love quotes. And this is one by Winston Churchill that says, "It takes courage to stand and speak. It takes more courage to sit and listen." One thing that we've really worked with our family and with our kids is working with our medical staff. Like, that is so important. They're kind of like family, right? You start with this group of people and doctors and nurses, and you're with them for years and years and years, and they become family, and we love them. And so we really try to teach our kids about respect and about being honest. Always be honest with your caregivers. And sometimes that can be a little bit tricky. My son Bridger, who's the feisty one, sometimes I wonder, I think kids kind of get it. Like, if I just answer yes, 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 I can leave a lot sooner. Right? And then I can hit the cafeteria and the gift shop, and this is going to be like, let's just get out of here, right? That's sometimes how I think he feels. And I don't know how they do it here, but at Cincinnati Children's, when you're about 14 years old, you meet with the staff, or the doctor and the social worker and the pulmonary, the respiratory therapist, all on your own. And later in the appointment, the parents are brought in. And I've always been disappointed in that. Like, I've never really wanted that to happen. I know that they're trying to teach about being an advocate, but part of me is like, man, my kids are tricky. I know they're going to I tell them to be honest, but I don't really know if they're being honest. And so it's been a hard thing for me. There's a story of some surfers who went to Hawaii on the island of Oahu. That's where my kids have been to school. And that is where, like, if you've heard of the North Shore, there's a ton of surfing there. So they have like the Van surfing competition. It's a huge deal. It's on ESPN. People travel from all over the world to come to Oahu and to surf. There was some surfers who traveled from Australia, and they were on the beach, and they were really ticked off because there was a barrier put up in the ocean, and they could surf the small waves, but they couldn't go out very far because of this barrier. And they were fussing and they were mad, and there was a surfer, an older gentleman, who was born from the sand. So if you're Hawaiian, they say you're born from the sand. And so after hearing these surfers complaining, he went up to them with some binoculars, and he said, "Take a look with the binoculars and see what's past the barrier." And one by one they did, and guess what was out there? Sharks. Sharks were coming. This was their feeding time. And so they put up the barrier as a safety net to protect people from swimming with the sharks, which I'm sure isn't always the best thing. And so all of those surfers kind of changed their attitude now that they knew what the barrier was. And so we've told our kids the barrier is the treatments and the enzymes and the things that you don't always want to do. And we can't see the future because we don't have that magnifying vision that the binoculars had. But that's why it's important to be honest with your caregivers, with your doctors, so that they can help with the barrier and keep you protected. Well, there was one particular time last year when my son Bridger was meeting with his doctor and with the staff, and I was sitting out in the waiting room and kind of anxious and wondering what was going on in there. I was in another room. And after about 45 minutes, which seemed kind of long, our doctor came in, and she said, after talking with Bridger, he's explained to us that he's had a lot of stomach aches, which he has stomach aches all the time. And she said, he's actually really in a lot of pain, and we want to admit him right now. And I was like, what? And she said, Bridger has, he's upset and he's crying and he's not feeling good. And did you know about this? And I felt so horrible because we were just there for a checkup. Like, I didn't know. But I'm so grateful that he listened and he was able to stand and speak and be able to explain to his caregivers how he was really feeling. And he was able to share with them that he was feeling like he needed to come to the hospital and get kind of cleaned out, but that he was afraid of what his teachers would think and what his coaches would think and what his friends would think. And he was thinking that he's a peacemaker, and he wasn't, and he was afraid, and he hadn't explained that to me. But I'm so glad that the staff had the courage to sit and to listen to what he had to say. Like, what an amazing blessing to be able to have a doctor who cares so much that she has the courage to sit and to listen, because there's so many things going on in your day, right? But I'm so grateful for that. So that's one thing that we've taught, is to make sure that you're always honest and to work together as a team. Another area that can be kind of tricky for families is with your spouse or with your partner or with somebody who's helping you navigate your way through CF. It can be hard. And so for us, for my husband and I, man, we're definitely not perfect. Holy cow, we've been married 31 years and there's been a lot of fussing, a lot. We're not perfect. But one thing that we came up with a couple years ago that's really been working really well, and it wasn't our idea, someone told us about it, and it's called washing the dishes, cleaning up the dishes. And so if you think about, if you get busy during the week and you just load up your sink with dishes, right? And so the food gets encrusted and you're too busy. So you're just putting the dishes in the sink, right? And then after a week, you come by and you're starting to clean the dishes, and now you've got some work, right? You got to put on the rubber gloves, you got to get the scrubby out, and it's taking hours to clean the dishes, right? Or what we usually do is after we eat, we rinse off the dish and we put it into the dishwasher. That's so much easier than waiting for the week. And so we call it washing the dishes. And it's become kind of like a ritual that we spend some time on. We try to do it every Sunday for just like 5 minutes, 10 minutes, put a video on for the kids. And it's a way for us to connect just a little bit, to kind of explain what the week's gonna be like, what goals we have for the week, if there's soccer games or this or that. And then we call it like we're cleaning up our messes. So if there's something that maybe my husband or something that I've done during the week that's been like annoying, and I'll be like, Ralph, dude, you were being so like, what was the tone that you were giving me the other day? Like, what was that about? So it kind of clears the air a little bit. But you have to be a little bit careful, because sometimes we're only looking for the negative that our partner's doing or the person that's helping us. We're only looking for the negative things. And that's not what I'm talking about. And it's not keeping score, right? Well, I did 5 great things this week and you only did 2 for me. Like, that doesn't work in any relationship. It's also kind of like, have you ever played that punch bug, slug bug game, right? So when you're not playing the game, you never ever see one of those cars, right? Never. But as soon as like a brother punches you in the arm, is like slug bug, you start seeing tons of them, right? It's the same kind of thing. What we look for is what we see. And so you have to be really careful that you stay positive. Find the good things that your partner is doing, not so much the negative things, because what we look for, again, is what we see. So we need to be careful in that. The next area that I was thinking about was, how about the siblings who do not have CF? What about them? They kind of get forgotten a little bit. This is my daughter, Beth. This is my second oldest with her brother, Brent. This happened, I learned a hard lesson many, many years ago. Beth was asked to be part of it was kind of like this. It was a family education day. And Beth was asked to be on the panel. So they had a person with CF, a mom, a dad, a grandma, different people on the panel, and they asked her to be a sibling of someone with CF. And we were excited, and they were on a big stage. And I don't remember the question that was asked to her, but I do remember how she reacted. And she couldn't even answer the question. She started to cry, and she started to sob. And she had to leave the stage before she could even utter a word. And I felt like this big. I didn't know what was happening. And I went out in the hallway, and she was being surrounded by the sweet staff. And after we talked, I realized that what I had been doing, I was trying to protect my kids that didn't have CF. I didn't want them to have the worry or the fear that I was having and the discouragement that I had. Sometimes I didn't want them to feel that. So I kind of placed them in this bubble. And that was the wrong thing to do, because all she wanted, and I've talked to my kids this week to kind of get their ideas of me. I was like, please tell me what I did good, because they have like 100 things that I did bad. Like, can you just tell me 1 or 2 things I did good? And this was one of them that they said, we really appreciate that we were involved in, like, can you go get their enzymes? Can you get them out? Can you go make a Scandi shake for your brother? Can you get their treatment out? Just like little simple things like that, because they wanted to do something. They just didn't know what to do. But by being able to just help on small things really made a big difference. And it still carries over today. My older kids always want to know what's going on. And with social media, that can be an amazing thing, but it can also be something hard for our families. Because sometimes I'll put something on Instagram on a story, and I'll be like, we're at Children's Hospital, Lily's like blowing up a PFT. And then I'll get a text from my son, Aaron, who's in Utah. He's 25. And he's like, what the heck, Mom? Is Lily okay? Like, why are you at the hospital? I'm like, it's just a checkup. It's okay. But he didn't want to hear from social media. He wanted to hear from me. Like, I should have just sent something out and said, hey, the kids are going in for just a checkup. We'll let you know how it goes later. So being able to remember that even when they grow older, that they're still the brother and they're still the sister, and they still want to be involved in what's going on. That was an important, very hard lesson for me to learn, to make sure we involve everybody around us. So how about the kids with CF? Like, how do we treat them? How do we help them find joy and find happiness when a lot of their life they have to deal with treatments and enzymes, and it just becomes like part of life, right? Because they're doing it all the time. It's a habit. It's a ritual. They're doing it all the time. But there are also many times when they worry and when they don't know what the future is going to be like. And what can we do to help those kids find the courage to be happy? So I asked my older kids, like, what did I do? Did I do anything right? And they said, the best thing you did was to treat us like a normal kid. Like, when there was things that needed to be done, you asked us to do it. You didn't use CF as an excuse. Now, my kids use CF as an excuse, because we would have chores to do, right? Like, okay, everybody, we're going to clean out the garage. And I swear, if not every kid in my family who had CF had to go to the bathroom. I'm like, how did you have to go to the bathroom? Like, if we're watching a movie, no one has to go to the bathroom. If we have to clean something, everybody has to go to the bathroom. Like, what's up with that? But treating them, they get in trouble just like everybody else. And that was a good lesson for them to realize, like, they're just a kid, just like everybody else, but they have a few other things that they have to do. So that was a good lesson too. Another thing that my kids said that they really enjoyed, and was something that was really hard for me to do sometimes, is to play games. We are a family who works hard and we play super hard, but I don't always like to play. And so I have to make myself. Like, I'm like, okay, you guys go to the park. I'm going to stay home. I had to make myself go and play and have fun and smile and laugh and make memories, right? That's the most important thing, is that we are able to make memories, good memories, laughing and having fun together. Like, that's what is really important. Let's see. Have you guys heard of Sean Anker before? He's amazing. He writes all about happiness. If you haven't read his books or heard, he gives a great TED Talk. He is amazing. He has tons of research on happiness. And he says each one of us is like the butterfly effect, and each tiny move toward a more positive mindset can send ripples of positivity through our organizations, our families, and our communities. How true is that? It just takes one person to smile to change your day. And we've taught our family the importance of service and being kind and smiling. And what a huge thing that's done for me. Like, sometimes when I'm feeling down in the dumps because of whatever, doesn't have to be CF related, anything. If I look out and try to serve somebody, I mean, it sounds like the corniest thing in the world, like the dumbest thing. But for me, if I I don't know, stop at Starbucks and grab a coffee for somebody that I know is having a hard day, it changes the way I feel. It's like, how does that even work? It seems dumb, but you got to try it. It's awesome. And we've taught our kids how to do that too. So that one little positive thing is definitely a ripple. And it makes a big difference in people's lives if we just look outside of our own. My daughter, Tess, who I was talking about earlier, this is something that has been a ripple effect in our community. Like I told you, she was an explosion of love that hit the earth. Before she passed away, we went on a Make-A-Wish trip. Let me tell you a little bit before that. When Tess would spend long days at the hospital, we would say to her, we wanted to take a little break, right? And we would say, we'll do anything you want. You want to go to, do you guys have Grater's here? Grater's ice cream? No? Oh my gosh. I should have brought you all some. It's the best ice cream in the world. But we'd say, well, you want to go to get Grater's? Or do you want to go to the toy store? We'll get you anything you want. Or go to the movies. And the only thing she wanted to do was hang out with horses. That was it. So we would drive to the country and try to find horses to hang out with. So for her Make-A-Wish trip, she decided that she wanted the whole family to ride horses. So we went to Colorado, and we went to a ranch called the Bar Lazy J. And for the week, we rode horses hours and hours, and it was so fun. Tess was on oxygen before we went. It was a miracle. The whole time we were there, she was not on oxygen at all. It was the best time ever. When we got home, she started into school. And about 7 days later, she started to feel bad again. And so I took her in to visit with our doctor. And while we were in her room, she took out markers and she started, how kids will start marking on their hands and on their arms and on their legs. And, I'm trying to be this good mom. And I'm like, Tess, don't write on your body, write on the paper. And then 2 days later, on a Friday, we woke up in the morning and I could tell that something wasn't right. Didn't feel right. It was like my mother's intuition or something was going on. It was really early. It was about 6 o'clock, 6:30. And I really didn't know what to do. We were in hospice, but we were at home. And Tess had been doing well. We just went to Colorado, just 11 days before. We just got home. And so I sent out an email to our doctor and told her that I felt like something was wrong. And she immediately called me on the phone and said, I'm going to send out the hospice nurse for an evaluation. And so around 8 o'clock in the morning, the Starshine hospice nurse came. And then about 15 minutes later, our doctor, Dr. Cheney, showed up. And I had moved Tess to my bedroom and laid her on my bed. And as we were standing there together, the hospice nurse grabbed Tess's foot and she said, "You got to take a look at this." And on the bottom of her foot, on both big toes, she had drawn the biggest smiley face. And we were all three like taken aback, like, what? Why in the heck is she drawing a smiley face? It should be a freaking frowny face. Like, she doesn't feel well. Why is she drawing smiley faces? Later that night, at about 8:30, surrounded by all of her brothers and her sisters and me, and being held by her dad, and I told you she was an explosion of love. Teachers from the elementary school, her uncles, aunts, grandmas, and grandpas were surrounding her as she passed away. That was another hard lesson, to be able to learn that despite what challenges we have and how we should draw frowny faces, to not do that, to put your head up, put your freaking head up and see how beautiful the world is and how important life is, just to take a chance to see joy and to experience it. How important. What a sick, terrible lesson that I had to learn. Now on August 31st, we have Tess's Toe Day. And we started it many years ago where we asked people, hey, draw a smiley face on your toe. Like, tell us something good you do it and send us a picture. And we did that for years and years. And then last year I thought, oh man, we've been doing this for so many years. I'm not even going to do it this year. People are probably getting tired of it. It's kind of dumb. We're not going to do it. And that was this year. So I didn't post anything, and I started to get hundreds and hundreds of pictures of toes. What a ripple effect. Something so tiny as putting a smiley face on your toe can change the way people think about things, at least on that one day. On August 31st, there's a lot of people drawing smiley faces on your toes. Just shows you how something positive can really make a change, something small. I wanted to end by telling you one more story. So a couple of months before Tess passed away, she and my older daughter, Beth, went to the mall, and this was right before Mother's Day. And they came home that Sunday, and they were just so excited. And later in the day, Tess laid this pink, shiny bag on my lap and said, "This is for you." And I was like, "What is this for? Like, you already gave me a Mother's Day present." And she was like, she was a little sassy girl. And she was like, "But you ruined my present." Because earlier in the week, there was this box and it had my name on it and I opened it. And so I ruined the surprise. And so she and my daughter Beth had went to buy me another present, a surprise. And so I looked inside the bag and there was this big crystal glass bottle of perfume, and the receipt was still in the bag, and I looked at it and it said $75, and I was like, whoa, she's been saving some money. Like, Tess, this is too much for me. Like, this is way too much money, and you already gave me a gift. And she was just not having it. And then I tried to explain, like, let's go back to the mall and we'll get a smaller bottle of perfume because it's too much money. And then she looked at me and she said, "Mom, like, it's my money. I want to do what I want to do with it." And then she said something that I will never, ever forget. And she said, like, wagging her finger, like, "Sometimes you just need to say thank you." And so I said thank you. And I took the bottle. And 3 months later, she passed away. Now, I keep that bottle of perfume in the top drawer in the bathroom. So when I get ready every day, it's there. And for years, I would spray it every single day. But then as the years have gone by, there's not much left. But when there's a day like today, when maybe I need a little push, I happily spray that bottle of perfume. And it's like I'm getting a sweet kiss from sweet little lips. And I'm reminded that that little bottle is a treasure for me. It's something that even when the perfume is gone, I will always treasure it. And that's what life is. It's a treasure. We need to find happiness and find joy and be able to help each other. Some of us are going to have a hard road home, and we need to be there for each other and somehow be able to put something on your toe and find some joy and remember that life is a gift. Thank you. Oh, you're sweet. I was supposed to leave some time for questions, so I don't know if anybody has any questions for my craziness, because that was totally unconventional, but anyways, if anybody has any questions for me, you're welcome to ask. Yeah.
So okay, amazing. So my question is with all your kids and with your daughter passing, CF is really hard and it kind of brings up mortality. How did you guys as a family handle the passing and then the inevitable, this could be my reality part of the disease?
Well, because of what happened with my daughter Beth and being open about CF, we are very open about it. But we don't dwell on that. Like, we dwell on, remember that barrier. Let's try to stay healthy. And we really, really focus on all the positive things. More of like, not what did I do bad this week, but more of like, what can I do to be better? And so it was hard. And actually my son Brent, who's the third oldest and has CF, he, to be totally honest with you, we didn't know this, but we found later after my daughter passed that he had in his mind had made this deal with God that he was going to be the one to die and not we all knew that. We knew that Tess was ill, right? And that she was in hospice, and we knew what was going to happen. But for him, he became really, really angry, and it was hard for him to understand. And for probably about 5 years, he felt like he was going to die. He was in high school, and he stopped having fun, and he was punishing himself because he made that deal, which you can't make a deal like that. But in his mind, he didn't understand that. And so we had to work for years on trying to help him realize that he does have a lot to live for. And then when my daughter Lily was born, which was unexpected, I had a ton of kids and I know how it works, so you don't have to tell me, I know how that works. She was a gift because her being in our family changed Brent. And he loves her so much that he tries super hard. And his life flip-flopped. And he became to work. He worked really hard. And his facial expressions changed. And and Lily loves Brent like, I can't even explain it. There's a connection that those two have. I think this probably sounds crazy, but I wonder, up in heaven, if she was like, God, send me down to this guy, send me down to this family, because I need to help him. And those two have an amazing connection. They both have CF, but he's changed now. And I think he lives for her, really, is what's happened. That was a lot of information, sorry. But yeah. Does anybody else have anything for me? Any ideas? Later you can tell me, okay, I got an idea for you to help you with those boys that you have.
I just wanted to say that I remember that panel discussion that Beth was on. So I was there that night, and they asked her if she worried about her siblings with CF. That's
what it was.
Tipped her over. And it's interesting that you felt like you had let her down and her brothers and sisters, because I can tell you that the team felt the same way. We thought that we let her down and the siblings, by not including them more, especially when they come to clinic and everything. So, we didn't think that way about you at all, but we, reflected on that, so it was very meaningful. And then I just wanted to say that Tess's toe day thing, the picture that you showed just cracks me up because in the upper right-hand corner, I don't know if anybody noticed, was
Did you see that?
the dog.
That dog. Oh, you can't really see it that well, but we get all kinds of pictures. We have,
That's my dog, Nerf.
Is that your
And so-
dog?
That is my dog. That's Nerf. And I will
Okay,
say,
I didn't know that, but I'm glad I put it on there.
you forget the Nerf picture.
I
But
know.
I just wanted to say that, talk about a ripple effect. My daughter had taken him he goes to Camp Bow Wow. It's a dog camp. And to the vet and a couple other places that week. And she, she was yelling at me. She's like, you put permanent marker on the dog. So that smiley face stayed on his paw. And she said everywhere she went, people were like, why does your dog have a smiley face on his paw? So she told Tess's story over and over again that week. So.
Yeah, there is a ripple effect. It's true. And I think sometimes on that point about, I think sometimes as parents, we feel really guilty about some of the decisions that we've made or that we're making. And it can be hard to not be so discouraged that you can't work your way out of that. And that's where I think it's so important to have friends, right? And some of my very best friends are moms who have kids with CF. Now, we can't get our families together, of course, but I call them when I'm having an issue and maybe I feel like I can't get out of the discouragement that I'm feeling and the guilty feelings that I have. And man, do those moms know, because they're walking the same path that I'm on. And so I think it's really important that you reach out to those around you. And when you need help, ask for some help. At least that's what helps me. Anybody else? All right. Well, thanks, you guys. Thanks for letting me come, and it's been so fun to get to meet you guys. Thank you. I'm pulling it? Okay, I did. This is so fun because I've never ever done this before, and you didn't forget. Okay, so I'm pulling out something for...
There's 2 raffles. So the first one is a gift card to different restaurants.
Okay, gift card to different restaurants. Linda Brown. Nice. And Linda was so nice. She shared with us some of her bread from Scotland. Like, that was so, you deserve this. Okay, and this one is an Amazon gift card. Thomas Hartley. Hartle? Yeah.
Tracy, thank you so much for speaking and sharing your family story with us. It was very meaningful, and yes, we all have a lot to learn from each other. So thanks everyone for coming this evening. Feel free to stop by the other vendors and try out a PFT and just take some time to talk with each other. We appreciate all of you, and yeah, we're so grateful to be in all of your lives. So thanks.